Hi, my name is Dr. Herb Hughes, and I practice in Alexandria, Virginia at Hughes Orthodontics. I've been in practice for 32 years, and today I'm going to show you a clinical case using 3M Clarity aligners. This is a 74-year-old female that had been treated with full orthodontic treatment approximately 10 years ago. The lower fixed retainer had come loose, and her lower anterior teeth had flared forward almost to an edge-to-edge position. She'd gone back to her original orthodontist, and she really wanted to have some type of clear aligners. He wasn't sure if it could be accomplished, so she came over to our office. I looked at her and I said, I think we can do that, and I think we might be able to do it with just aligners just on the lower arch. So this is the original photos. Here's our progress photos after 6 aligners, and you see those lower anterior teeth are starting to come back. This is approximately 8 weeks into treatment. And here she is after 13 aligners, and it was approximately total treatment time of just a little under 4 months. And as you can see, the lower anterior crossbite has been resolved, and the lower teeth are really nicely aligned. And here are some of the images. The yellow is the original, blue is kind of our final position, and the white was the goal. And what you can see is that the teeth tracked very, very well. We were very, very pleased with the results with the aligners. This is a nice overlay, and it shows where the yellow was the original position and the blue was actually the final position. So they came back very nicely. And just wanted to take you through the oral care portal and just kind of walk you through in terms of our setup and what I was looking at as I set this case up. Initially that I noticed was that there was a pretty aggressive IPR of 0.5 millimeters. You can see it's almost edge to edge, anterior bite relationship. And so we wanted to be able to tip those lower anteriors back. But I was thinking the amount of IPR is too much for those lower anteriors. Once again, you see it's 0.5 millimeters. So what I did was I put in the instructions to the left. I advised to only reduce it by 0.2 millimeters so that we would be able to bring it back but not take off too much enamel. So let's take a look at setup number 2. But when I was looking at the amount of IPR, I look at the mean averages, and for the mandibular and central incisors, it's about 5.5 millimeters. The laterals are 6 millimeters. The canines are 7. And if you look at the analysis that is in the oral care portal, the Bolton analysis, it shows that we've got some of the teeth that are just a little bit larger, but we don't need a 0.5 millimeter of reduction. So I reduced it down to 0.3 millimeters, as you can see here. And we have a couple of attachments to be able to give us more control over the movement of those teeth. So let's take you through in terms of the movements. And you can see the stages. She had 13 aligners, and she changed the aligners approximately every 7 to 8 days, as she made that change. If you look from the occlusal view, you'll see how they came back nicely. Yes. And here's the final result. And as you can see with the overlays, that it mirrored really right on target with those. And here is the patient at the conclusion, and extremely pleased about her final result, and also the speed at which it was able to give her that final smile.